Mr. Regan. I'm Emily. I'm the nurse practitioner. I'm going to be doing your final exam today. We're going to kind of progress from a head to toe fashion. If you have anything that causes pain or tenderness or anything like that, just give me a heads up and let me know, okay? All right, so to begin, I'm just going to wash my hands real quick. You can use some if you want. All right, so first I'm just going to inspect your head and your face. Just taking a look at everything. Okay. Go ahead and look down for me. Thank you. Just feeling for any sort of lumps. Okay, go ahead and look back up. All right, and look at your skin. Look straight ahead for me. All right, I'm going to ask you to do a couple things. First thing, just close your eyes really tight. Okay, and open them, and try to make a wrinkle in your forehead. We're raising your eyebrows. Good. Okay, smile without showing your teeth. Okay, and frown, and puff out your cheeks. Kind of more this way. Good. Purse your lips for me, and then clench your teeth. All right, and now I'm going to feel this TMJ right here, and I want you to open and close your mouth. Good, and again, okay. I'm going to go ahead and feel your sinuses. Nothing's tender in there, right? Okay, good. All right, so we are going to go ahead and move on to your eyes. So first I'm just going to take a look. Good. Open them for me. Good. Okay, so I know we tested your distant vision, or your distant vision out there, and you were 20/20. You don't wear glasses or anything, right? Mm-hmm. Okay, so we're going to test your near vision as well. So with this, I just need you to hold the card about this far away from you, and I want you to cover your right eye first. So hold with this hand, and cover your right eye. Okay, and what is the lowest line that you can read? Go ahead and read it out to me.
438,738.
Okay, and that's the lowest one you can read?
Mm-hmm.
Okay, and switch and do the other eye for me. Okay, and read it backwards this time.
837,824.
Okay, and now with both eyes, can you read the same line?
428,739.
Okay. Okay. All right. Good deal. Alrighty. So now I'm just going to go ahead and test some reflexes here. So just open your eyes real wide for me, okay? Okay. Open. Good. Open. All the way. Good. All right. Now we're going to test some of your sensations. I'm going to have you close your eyes. I want you to tell me if you feel dull or sharp, okay? Mm-hmm. This is what a sharp is going to feel like, and this is what the dull would feel like, okay? So tell me which it is, but close your eyes. Okay?
Sharp. Dull. Dull. Sharp. Dull. 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 Sharp.
Okay. And now, same thing, I just want you to tell me when you feel this sensation, okay? Keep your eyes closed.
I feel it.
Okay, good. All right. So I'm going to test your peripheral vision. So I need you to look straight ahead, and I'm going to wiggle my fingers, and I need you to tell me when you see them, okay?
Right there.
Okay.
Right there.
Okay.
Right there.
Okay.
Right there.
Okay, and up here.
I see it.
Okay, good. All right, so I'm going to just take a look in your eyes for me. Look straight back, not at the light, okay? Keep your eyes open. Good. All right. Good. Good. Okay, one more time. Good. All right. So looking straight ahead, I'm going to have you follow my finger through a couple of different gazes, okay? So don't move your head at all, you're just following with your eyes, okay? So I'm going to hold your chin still just to make sure that you don't move your head, okay? Good. Good. Okay. Good. Keep looking. Okay, good. All right, now I'm going to put my finger here, but I want you to go ahead and look at that clock behind me, and then when I tell you to look at my finger, you switch from looking at the clock to my finger, okay? So look at the clock, and now my finger. Okay, clock, finger. Good, okay. Alrighty, so one more thing I'm going to do, just want to come back here. Good, okay. Now I'm going to take a look inside your eye with this, okay? Or just put that hand sanitizer on. My hands are slick. I can't. There we go. All right. So I'm going to look at your right eye first, okay? I need you to just keep them open. Open. Okay, and now we're going to do the other side. All right. Keep your eye open. All right, and go. Go ahead and turn my left up there. All right, so I'm going to go ahead and I'm going to press on your ears here. Any of that sensitive or hurt? No? Okay, I'm going to go ahead and look inside your ears. With my otoscope. All right. Okay, we'll do the other side as well. All right, and good. Okay. So now I'm going to also just look in your nose. So I'll have you tilt your head back like that. Perfect, good. Okay. Good. All right, good. Now I'm going to have you occlude one side of your nose at a time. So either side first, it doesn't matter. So just press one. All right, and breathe in and out. Okay, do the other side. Okay, we're going to test your sense of smell, okay? So I need you to keep your eyes closed. I'm going to have 3 different scents, and I need you to tell me what they are when you smell them, okay? So go ahead and keep your eyes closed for me. And this is the first one, okay? Let's go ahead and take a sniff.
Garlic.
Good, okay. And this is the second one.
Cinnamon.
Good. And this is the third one, okay?
Lemon.
Good. All right, so your sense of smell is intact. All right, I'm going to put some gloves on. We're going to move to your mouth and your lips. So first I'm just going to take a look. Okay, go ahead and open for me. Tilt your head back just slightly. Good. All right, I'm going to take this. I'm just going to use this to look inside, okay? That's okay. All right, just looking at your gums and your teeth, inside of your lips. Good. Okay, lift your tongue up for me. Good. Okay. All right, and I'm just going to have you say ah. Good. All right. I know, nobody likes that. All right, open up for me again. Good. All right, great. going to have you stick your tongue all the way out. Okay, move it from side to side. Okay, curl it up towards your nose and down. All right, good. Now I want you to push against your cheek, and I'm going to press against your tongue and try not to let me push. Just testing the strength of your tongue. Good. All right, on this side. Okay, great. All right. So one thing I forgot to do, so we're just going to go jump back to that, is your hearing, okay? So first I'm going to strike this. I'm going to put it on top of your head, and I want you to tell me if you hear it in one ear better than the other ear, or if you hear them the same, okay? All right. All right, we'll try again.
The same.
Same? Good. All right. Now we're going to test. I'm going to place it here, and I want you to tell me when you stop hearing it, and I'm going to quickly move it beside your ear, and I want you to tell me when you stop hearing that, okay? You ready?
Mm-hmm. Stop.
Still hear it?
Stop.
Okay. We'll do the other side as well, so same thing, okay?
Stop. Stop.
Okay, great. So now we're going to just do a slight whisper test. So I'm going to need you to occlude this ear for me. Just kind of stop it up so you can't hear out of that ear, okay? And I'm going to whisper something, and I want you to tell me what I whisper, okay?
Mickey Mouse.
Good. All right, we'll do this side as well. Perfect. Okay, and look that way for me so you can't see me. Look that way. Good. Okay.
99.
Good. Perfect. All right. So we're going to move on to your neck. Okay. So I'm just going to inspect. Kind of look at your skin here. Good. Okay, swallow for me. Okay, good. All right, I'm going to feel your lymph nodes a little bit. I'm going to take my gloves off for this so I can just feel a little better. All right. Let me know if you feel any sort of tenderness or anything like that, okay? All right. I'm going to ask you to do a couple of motions with your neck, okay? So first I want you to touch your chin to your chest. Good. And now look up towards the ceiling. Touch your ear to your shoulder on each side. Okay, good. And then turn your neck like you're looking towards the wall and towards that wall. Okay, great. Now I'm going to ask you to not let me, I want you to try to move your head this way and don't let me move it back, okay?
Mm.
Good. Okay. And same with this one. Look. Don't let me move your head forward. Good. And bend your head this way. All right, don't let me move it up. Good. We'll try the other way. Good. Okay. I'm going to look at those muscles. And if you don't mind turning a little bit that way so I can just look at the back side as well. Okay, just feeling those muscles. Just going to palpate here. No tenderness, right?
Mm.
No tenderness there on either side. Correct?
Mm-hmm.
Okay. All right. Great. So now I'm just going to look at your thyroid gland, okay? So I'm going to ask you to, hang on just a second, take a sip of water, and I want you to hold it in your mouth, and I'll tell you when to swallow it, okay? Great. So hold that for me. All right, look straight ahead. All right, go ahead and swallow. Great. And and take another sit for me. We're just going to do the other side as well. And extend your neck just a little bit. Look normal, but just extend your neck just a little. Okay. All right, go ahead and swallow. Good. All right. So that's good. So now we're going to just move on to your chest and your back and your lungs, okay? So first I'm just going to look at everything. Good. Good. I just want to feel the temperature of your skin. I'm going to pinch here, just assessing the turgor of your skin, which is really good. Okay, I'm going to do over here too. I'm going to feel the skin on your arms. Good. Okay. And now if you'll turn that way so I can look at your back. Oh, scoot back this way for me. Okay, good. Perfect. Okay, and just kind of lean forward. There we go. Looks good. All right, so I'm just going to palpate a little bit, just feeling your muscles. Don't have any tenderness there, do you? Okay, we'll do the same thing on the front side. Okay, go ahead and stay forward like that. All right, so I'm going to just sit back here. I'm going to ask you to turn, kind of point your feet that way. Good. All right, so we're just going to, I'm assessing the excursion. So, oh, that's probably not, no, I need you to be with your feet that way. Good, okay. All right, so go ahead and just take a deep breath for me. Good, and again. Okay, good. All right, so I'm going to go ahead and I'm going to just palpate some, or percuss some areas here, okay? Just seeing. Good. And I'll have you raise your arms up over your head. Good. All right, and if you want to turn back towards me, we'll do the front side. Good. All right, and turn back so I can see your back again, sorry. Obviously your movement is good and strong. All right, so I'm going to ask you to do a couple things. So first, just take some normal breaths, and then I want you to take a deep breath and hold, okay? And tell me when you're ready. Go ahead and take a deep breath and hold it, okay? Good. All right, so right there, I'm just going to put a little mark on you, okay? And we're going to do the same thing on the other side, all right? So breathe normally. And deep breath and hold. Good. All right, so now we're going to do something similar, except I want you to exhale and hold, okay? So breathe normally. All right, and exhale and hold. All right. All right, and over here, same thing, okay? So breathe normally. All right, deep breath, exhale, and hold. Good. All right, I'm just going to measure that space. Good. And good, perfect. All right. So I'm going to go ahead and I'm just going to have you say 99 for me a couple of times. Every time I place my hands on your skin, say 99, okay?
99. 99. 99. 99. 99.
Good. I'm going to do the same thing on the front.
99. 99. 99. 99.
All right, good. Turn back around for me if you don't mind. All right. And I just want you to tell me if you feel any sort of tenderness in this area, okay? Anything?
No.
How about here? No? Okay. All right. Oh no, we'll start on the back. I'm going to go ahead and listen to your lung fields, okay? So just want you to take some deep breaths for me and just keep breathing kind of deeply. All right, raise your arms up over your head. Listen on the sides. Deep breath. Over here. All right, I'm going to ask you to say any combination of letters or numbers, and I'm just going to listen, okay? And just keep repeating it.
A, B, C, D.
Well, sort of like we did with the 99. Like every time I put my stethoscope down, don't say 99, but pick anything and just kind of say that a couple times every time I place my stethoscope, okay?
Mm-hmm.
All right, go ahead.
69. 12. 2. 7. 9. 4. 6. 52. 100. 12. 7.
All right, we're going to do the same thing, but this time whisper it, okay?
12. 6. 7. 4. 1. 15. 20. 30. 40. 72.
All right, and this time say the letter E.
E. E. E. E. E. E. E. E. E. E.
Okay, good. Now have you spin around. We're going to do the other side. Just going to listen first, okay? Deep breaths. All right, same thing with the letters or numbers combination, okay? I'm just going to listen. No, out loud, please.
12. 4. 5. 20. 6. 100. 100.
Now whisper.
4. 6. 5. 11. 13. 6.
All right, now the E.
E. E. E. E. E. E. E. E.
Okay. And while you're sitting up, I'm going to go ahead and listen to some heart sounds, and I'm going to listen to your, or I'm going to test how long your pulse is, okay?
Pulse ox, yeah.
Stay still for me. Okay, good. So your pulse was 64, which is good.
That's good. Yeah.
And your respiratory rate was 14, which is also good. Okay, so I'm gonna listen with the other side of my stethoscope now, okay? Look straight ahead for me. Okay, and just this way. Okay. All right, so I'm going to go ahead and have you lay down now. Okay, and turn your neck that way. Good, and back this way. Okay, just looking for any bulging, which I don't see, so that's a good sign, okay? And I'm going to go ahead and just sort of look at your chest and shine some light. Okay, I'm going to go ahead and look at the skin of your abdomen while we're at it. Okay. All right, I'm going to go ahead and palpate, make sure my hands are warm. All right. All right, I'm going to go ahead and feel your pulse here too. Good, okay. So I'm going to go ahead and listen again, all right, in this position. Same areas, listen to your heart. Inhale for me. All right, I'm going to have you turn on your left side, and I'm going to listen from that position. Good, okay. Oh. Inhale for me. Just going to feel here. Okay. Listen one more time. All right, good. Go ahead and have you turn over and lay back on the back. All right. I'm just looking at your skin. I'll have you straighten your arms out for me, okay? I'm going to go ahead and I'm going to feel your skin here. And your skin here. Go ahead and uncross your legs for me. Good, good. All right, I'm going to feel your pulses. Good. Good. I'm going to feel right in here. I'm just going to pull this area down just a little. Good. And bring your legs up like this on both sides. Good. Just feeling for your pulse. Good. Make sure Okay, good. All right. Just look at your feet down here. Skinny, good. Look at your hands here, good. All right, put your nails like this together. Just looking at that angle. Okay. All right, and let me see your nails, please.
Yeah, let's do it.
Thank you. Okay. I'm pressing on all these. I just want to see how they adhere to the nail bed and everything looks good. Okay, all right, good. So I'm going to go ahead and I've already looked at your stomach. Now I'm going to listen, okay? Just going to lower this and listen just a little lower, okay? Same thing on this side. I'm going to listen over where your liver would be. And your spleen. Okay, good. I'm going to percuss a little bit in your abdomen, okay? Good, okay. So now just have your arms come straight down, good. I'm going to try to percuss to hear where your liver is, okay? You don't have to do anything. So we're going to start up here. Make a little mark on your skin, okay? All right, now we're going to percuss up. Let's do that one more time. All right. Relax for me, okay? Actually, right here. Okay, I'm not going to go up this time. All right, and I'm just going to measure that distance. Good. So 6 centimeters, that's good. All right. Now I'm going to just palpate a little bit. I'm going to start light, but I am going to move to a little bit of a deeper palpation, okay? Let me know if you feel any tenderness anywhere. Don't want you to be having any pain. I'm going to go a little more medium. And a little deeper, okay? Okay, I'm just going to have you lower just a little bit, and we will drape you. I'm just going to assess for any hernias or bulges or anything in the inguinal area, okay? Mm-hmm. All right. Good. I'm going to palpate for your lymph nodes down here too. All right, good. All right, you can raise those back up. Good. All right, so I'm going to try to palpate your liver. All right, so I'm going to place my hand under here. All right, I'm going to have you take a deep breath for me. Okay, great. We're going to do the same thing on this side. Trying to fill your spleen here, okay? Deep breath. All right, we're going to try to do your kidneys. I'm going to come a little deeper here. Okay, on this side. Okay, good. All right, so I will have you go ahead and come back to a sitting position. Just before you do that, actually, I forgot one more thing, sorry. While you're laying down, I'm going to steal this pillow from you, and I want you to lift your head up. I just want to take a look right now, a little further. Okay, good. All right, now you can come to a sitting position. All right. So I'm going to test some of your movements with your muscles, okay? We're going to start, we already did the neck one, so that's good. We're going to move to the elbows, okay? So first I'm just going to go ahead and I'm going to look. I'm going to feel a couple of areas here. Go ahead and flex this way for me. Okay, and there's no tenderness, redness, swelling, anything in any of those areas of those joints, okay? Do the same thing over here. Straighten. All right, and turn. Good, good. All right, okay, so the movements with your elbows, I'm going to have you flex them first. Good, and extend. Good. Now I want you to put your hands like this. Good. And you're going to pronate and supinate. Pronate, supinate. Good. Now I'm going to do those movements, okay? Just so I can feel your joints move. Okay, and we're going to do it again. Good. All right, and let me flex and extend. Flex and extend. Good, and we'll do this one. All right, flex and extend. Flex, extend. Good. No crepitus, cracking. There's no pain with those movements. Everything feels okay, moves smoothly, no issues there, right? Okay, good. So we're going to go ahead and we're going to move on to your knees. So first I'm just going to take a look. Areas here. I don't see any bulges, no redness, no swelling. Nothing's tender while I'm pushing on it, right? Okay, same thing on this one. Okay, good. So I'll have you stand up. All right, and with your knee, I want you to raise it. Flex. Good. And extend it back behind you. And straighten. Good. Now do the other one. Good. And straighten. All right, now let me flex your knee. Oh, yeah, you can hold on to me if you need to. Let me flex your knee. Allow me to. Okay, good. And straighten. Good. Okay. Flex. And straighten. Okay, I'll have you go ahead and lay down. We're going to do that kind of in the laying position to test the strength there, okay? All right. Straighten. Good. Straighten. Good. When you do that, let me see that movement. Good. All right, so with it straight, do not let me flex your knee, okay? Good. And same over here. All right, now go ahead and flex it. And I don't want you to let me straighten it, okay? Good. And this one. Good. All right, we're going to move on to your ankles. So I'm going to have you kind of turn this way. Good. Scoot back just a little bit. All right, I'm going to go ahead and look. Feel no tenderness in any of those areas, right? Okay. All right, so I'm going to have you point your toes up to the ceiling. Good. And point them down as far as you can. All right, turn your ankles in towards each other and out. All right, now I'm going to do those movements. Allow me to, okay? Up, down, good. Up, down, and this way, that way. Good. So now we're going to test the strength, okay? So just like before, I want you to point them up towards the ceiling and don't let me push them down, okay? Good. And now this way, and don't point them down and don't let me push up. Okay, good. Now you press on my hands like they're gas pedals. Perfect, as hard as you can. Okay, good. All right, so that was good as well. I'll have you slide forward. And I just want to have you stand up. Good. All right. So I'm going to have you close your eyes. And I'm going to push, and I just want you to regain your balance, okay? Good. Good. All right, go ahead and sit back down. And scoot back so that your knees are dangling. I just want to test those reflexes of those knees. Okay. Good. And this side. Good. All right, and we did the elbows too, so we'll go ahead and test this reflex here. So just dangle this arm. Good. Good. Keep it loose, okay? Good. Okay. All right. And that is everything. I'm going to step out so that you can get redressed, and then we'll kind of talk through everything and all my findings, okay? All right. Thank you. Now that we've done the whole head to toe, I'm going to talk about the steps in the breast exam, the genital exam on both a male and a female patient, as well as a rectal exam. So I will go ahead and start with the breast exam. So when you're inspecting the breasts, you want to first just take a look. You're going to note the size and the shape. You're going to check for symmetry. You're going to assess the contour, which should be uninterrupted. You would inspect the skin and the texture. You want to note any retractions or dimpling, anything like that. You would also note the venous patterns on the breasts. They should be the same or similar bilaterally, and you're going to check for lesions. Then you would inspect the area of the areola and the nipples, noting the shape, the color, and the texture. You want to check for nipple eversion, retraction, or deviation. For a female patient, you would do this in 3 different positions. You would want to do it with their arms extended overhead or flexed behind their neck, kind of like this, or like this would also work. Then you would do with their hands pressed on their hips and rolling their shoulders forward. And then you would do it also with them leaning forward while they're seated. After you've inspected, you would palpate the breast and the axilla with the patient seated. First, you would do this by performing a chest wall sweep. So to do this, you would place your right palm at the patient's right clavicle at the sternum and sweep down to the nipple, feeling for lumps, and you want to make sure that you cover the entire chest wall. And then you would repeat on the left side. Then you would do a bimanual digital palpation. So to do this, you would place the palm of one hand across the breast tissue, and you would feel for lumps while compressing the tissue against your palm. And then again, you would repeat on the other side. Then you would move to palpating the lymph nodes. You would palpate by supporting the patient's arm with your left hand, and then you would use your right hand to examine the axilla. You want to move your hand from the apex to the bra line and make sure that you palpate the medial, lateral, anterior, and posterior walls of the axilla. You also want to palpate down the inside of the upper arm to the elbow. And then again, you would palpate the supraclavicular and infraclavicular areas as well, noting any lymph nodes. After you've done that, you would have the patient get into a supine position to continue the palpation of the breast tissue. With this, you would have the patient raise their arm behind their head, and you would place a small pillow or a folded towel under their shoulder. The goal is to have the nipples pointing towards the ceiling. So you want to position them so that that's the position that they're in. You're going to palpate all 4 quadrants of the breast tissue as well as the tail of Spence. You would rotate your finger pads, and you would use light, medium, and deep pressure. There are a couple of different techniques you can use to palpate the breast tissue. You can do the vertical strip technique, which is kind of just like up and down all along the breast tissue. You could do concentric circles, which is just
all around like that. Or the wedge technique would be kind of palpating in every area, like a wedged area, all the way around the breast and into the tail of Spence. You would then press the nipple into the wall behind the areola. You could compress the nipple to check for discharge, but that's really only done if they've reported spontaneous discharge. The tissue of the breast should feel dense, firm, and elastic. There shouldn't be any masses, lumps, or nodules. If you do detect a breast mass, then you need to characterize it by palpating for its dimensions, its consistency, and its mobility. You can instruct with women especially that they should be familiar with how their breasts normally look and feel, and that they need to report any changes to a healthcare provider right away. Some things that are warning signals would be a lump, a hard knot, or thickening inside the breast or their underarm area, swelling, warmth, redness, or darkening of the breast tissue, changes in the size or the shape, dimpling, or like a pulling or puckering of the skin, any sort of scaling, rash, or itchiness on their nipples. If their nipple sort of pulls in or other parts of the breast are pulling in, nipple discharge that starts suddenly, or new pain in one spot that does not go away. These can all be warning signs, and these are things that a woman should be checking for on a regular basis and should notify their healthcare provider if they detect any of these things. And this is true for men too, and that would be the breast exam. Then on a male, for the genital exam, before you begin, it's important that you remain professional. You want to be matter of fact. You want to communicate very well to minimize the patient's anxiety and discomfort. So first, with the male, you would inspect the genital hair and its pattern and distribution. Then you would inspect the penis, making sure to look at the dorsal and the ventral surfaces. For an uncircumcised patient, the foreskin needs to be retracted, and you can do this or you can have the patient do this. You would examine the urethral meatus, observing the orifice. It should look like a slit on the ventral surface. And then you would press the glands between your thumb and your index finger in order to open the orifice and inspect that. You would then palpate the shaft of the penis, and you're looking for any sort of tenderness. It should be soft and non-tender and free of any sort of nodules. You would also strip the urethra by applying pressure with your thumb and your index finger from the base of the penis to the glands. If this produces any discharge, it can be a sign of an STD. And then after you've done this, you would have the patient reposition their foreskin if they're uncircumcised. Then you would move to the scrotum. Again, you want to inspect first. You're looking for the color, the texture, the symmetry. A lot of times in male, their testicles are asymmetrical. You also want to look for the thickness, and you would note any unusual thickening. You would palpate the testes, the vas deferens, and the epididymis, and you would do this by using your thumb and your first two fingers. The testicles should feel smooth, rubbery, and free of nodules. The epididymis should be smooth, discrete, and non-tender, and the vas deferens should feel smooth and discrete, which shouldn't have any lumps. You would also elicit the cremasteric reflex bilaterally. So you do this by stroking the inner thigh with a blunt instrument. You can use the opposite side of a reflex hammer. And when you do this, the testicle and the scrotum should rise on the side that is stroked. And you want to test both sides. Then you can assess for inguinal hernias. To do this, you would insert your finger into the lower part of the scrotum and move along the vas deferens into the inguinal canal. When you feel the oval external ring, you have the patient cough or bear down. If a hernia is present, you would feel it bump against your finger. Again, during the scrotum assessment, you should discuss self-examination with the patient, instructing them to be familiar with how it normally looks and feels, and to be looking for any warning signs. You would also, in the male patient, palpate the prostate gland. This could be part of the rectal exam. You would use your index finger to palpate the posterior surface of the prostate gland through the anterior rectal wall. You would estimate it for its size. You want to assess the contour. It should be rounded, symmetrical feeling. You would palpate the consistency of the gland. The prostate gland is normally firm and smooth. They describe it similar to a pencil eraser. And then you also want to evaluate its mobility. If palpation of the prostate gland causes any secretions to appear at the urethral orifice, they can be prepared for a specimen. After this, you would withdraw your finger and you can examine the fecal material. The stool should be soft and brown, and if necessary, you can use that stool to perform a fecal occult blood test. And that is the male genital exam. So with the female genital exam, prior to the exam, it's important to have the patient empty their bladder. You should reassure the patient, explain everything that you're going to be doing throughout the exam. You also want to ensure privacy and make sure that the room is at a comfortable temperature. You want to drape the patient so that they have minimal exposure, and then you can help them into the lithotomy position with their knees open. First, you want to observe the pubic hair again, noting the characteristics, and then you would also observe the external genitalia. You would inspect and palpate the labia. There shouldn't be any swelling, no redness, tenderness, discoloration, lesions, or inflammation. You also assess the clitoris. You're going to observe for atrophy, inflammation, adhesions. You want to inspect the urethral orifice and the vaginal introitus. So after that, you want to go ahead and move into palpating. So with the labia separated, you would evaluate the skein and Bartholin glands. To palpate the skein glands, you insert your index finger into the vagina, and then you would press your finger up and move forward, or move the finger outward on both sides of the urethra and then directly on it. You want to note any discharge or tenderness that occurs while you're doing this. And then with the Bartholin glands, you use your thumb and the intravaginal finger to palpate the tissue around the vaginal entrance. Again, noting any discharge, tenderness, swelling, masses, or heat. If indicated, you can also test for muscle tone, and you would do this by having the patient squeeze her vaginal opening around your finger. You could have the patient bear down to note any uterine prolapses or urinary incontinence that might occur. You would also inspect and palpate the perineum and the anus for the color and the characteristics. Again, noting tenderness, inflammation, redness, lesions, any sort of abnormalities. Next, you would do the speculum exam. So you would lubricate the speculum and your gloved fingers. You want to slowly insert the speculum into the vaginal canal, following the path of least resistance. Then you would lock the speculum in place in order to inspect the cervix. So when you're inspecting the cervix, you want to note the color, the position, the size, the surface, any discharge in the shape of the cervical os. Any discharge should be odorless. The color can vary from clear to cream colored. The cervical surface should be smooth. You want to be alert for any red, granular tissue or white patches. The cervical os should be small and round. If a woman has not had any babies, but in a multiparous woman, it could be horizontal, irregular, star-shaped. It can vary. This is when you would collect any specimens if indicated for testing. For a pap smear, you would use a spatula or a cervical brush to obtain cervical cells. You could also do a gonococcal culture, DNA probe for chlamydia and gonorrhea, a wet mount, potassium hydroxide test. So this is the step in which you would collect those. When you're finished, you would unlock the speculum, and slowly remove it from the vagina. As you do this, you want to inspect the vaginal walls for 4 characteristics, and you want to note the color, which should be as pink as the cervix or could be slightly lighter. The surface, which should be moist, smooth, and should look the same throughout. Any secretions and any hernia protrusions. You would then go to the next step of the general exam, which would be bimanual examination. You would go ahead and change your gloves and then again lubricate your index and your middle fingers. Those are the fingers that you would insert into the vagina. So you want to palpate the vaginal walls. Again, they should be smooth, non-tender, feel the same throughout. You would palpate the cervix, noting the size, the length, the shape, the consistency, and its position. You can move the cervix. It should move painlessly. Then you would place your other hand on the abdomen, and you would bimanually palpate the uterus, noting 3 characteristics. You want to check the location and the position, its size, its shape, and its contour, and you can also assess for mobility. Then in the right and left lower quadrants, you would palpate for the ovaries and the adnexa. If palpable, the ovaries should be smooth and firm and kind of ovoid. A healthy ovary will be slightly tender to palpation, so that is a normal finding. The adnexa are not usually palpable, so you want to note any masses or tenderness, okay? The next step of this would be to do the rectovaginal examination. Here you want to go ahead and change your gloves and lubricate your fingers. You want to tell the patient to breathe slowly and relax their muscles, reassure them. Again, you're telling them every step before you perform it. First, you would just assess the anal sphincter, and you do this by inserting the index finger into the vagina and your middle finger into the rectum. You would palpate the anal-rectal junction and then just above it. You would have the patient tighten and relax the sphincter to assess the tone. To evaluate the rectal walls and the rectovaginal septum, you would slide your rectal and vaginal fingers in deeply and then have the patient bear down. The rectal wall should be smooth and uninterrupted. You want to note any thickness, tone, and note any nodules. To palpate the uterus, you would press down with your abdominal hand and press up with your vaginal finger. And then you would palpate the posterior side of the uterus. To examine the adnexa, repeat the same maneuvers as you did in the bimanual exam. Again, when you withdraw your rectal finger, first you want to rotate it to assess the posterior rectal wall, and then when you withdraw it, you can look at the fecal matter, note the color of the stool, and you can inspect it for blood, and again, an occult blood test could be performed if needed here. With the rectal exam, it's important to be calm, slow-paced, and gentle. Again, with all of these, you want to explain what's going to happen step by step because patients can have a lot of anxiety during this exam. You can have the patient get into one of 3 positions, knee to chest, left lateral with the hips and the knees flexed, or they can stand with the hips flexed and the upper body supported by the exam table. With the female patient, you could also perform this in the lithotomy position like we just previously discussed. You would inspect and palpate the sacrococcygeal and perineal area, or the perianal area, excuse me. This skin, it should be smooth and uninterrupted, no masses, lesions, tenderness, redness, excoriation. You would spread the buttocks apart, and you can use a pen light to examine the anus, observing the skin. You can ask the patient to bear down because this would make rectal prolapse, fistula, any fissures, hemorrhoids easier to detect. You would then lubricate your gloved hand and examine the anal sphincter. You will press the pad of your finger against the anal opening and have the patient bear down. When the sphincter relaxes, you can slip your fingertip into the anal canal. To assess the tone, you can have the patient tighten their sphincter around your finger, and then you can rotate your finger to palpate the anal ring. To examine the rectum, you would insert your finger 6 to 10 centimeters further into the rectum and palpate the rectal walls. When palpating the anterior wall, you should have the patient bear down and then palpate a little deeper to detect any tenderness or nodules. You would perform a digital palpation by pressing your thumb against the perianal tissue while you move your index finger toward it. This can help to detect any abscesses that may be present. On a female patient, we previously discussed this, but you would palpate the rectal wall during the rectovaginal exam. And on a male patient, you would continue on to examine the prostate like we discussed for the male genital exam. Again, at the end of the rectal exam, when you withdraw your finger, you can assess the fecal material and perform a fecal occult blood test. And that is the step-by-step of the genital exam, the breast exam, as well as the rectal exam.